Hi, this is Dr. Farley, and if you're watching this video, this is to give you some information about what we do with our basic and comprehensive biomedicine treatment and the breakdown of services that we provide. So, this is not a quick blood test or specialty blood work and boom, you're done. This requires me to go through the entire file, understanding all of your history, understanding all of your paperwork, understanding all your old blood work, understanding any testing that we did here in the office. Again, in the office testing, which is normally our Super 7 Plus testing, putting all of that together, then taking the time as the blood work comes in to digest and synthesize all of that to come out with a coherent plan of action so that we can, one, through proper testing, identify the proper mechanisms of action specific to you, and then set up the best plan of action to restore function to whatever level we can. We're trying to gain as much function back as we can. We're trying to, number two, get stability. And number three, if someone is going to progress in whatever the process or diseases that they may have that they're suffering with, we want to try to keep it at the slowest rate possible. And many times, there is recovery that can happen. I also want to stress again, the word cure is total propaganda. There's nothing that's going to cure anything. It's a bunch of baloney. The only thing that we can do, if we're looking at true health care, is to look at what's not functioning properly, measuring it, identifying it, and then saying, what are the mechanisms? And then what can we do to influence those mechanisms so that we can get a shift in function, and a shift in function raises the person's healability. And by identifying those mechanisms, those are the epigenetic mechanisms. Many times, most diseases, 95% of them, are epigenetically induced. We're experts in the epigenetic science. We're also experts in identifying what are the exact stressors that have raised and thrown off your allostatic stress load, and what can we do to change and modify that so that we can allow proper function to go to a higher level and increase the person's healability over a time frame. So some of the stuff that we do with the basic and the comprehensive biomedicine, it includes an in-depth review of, for me, to look at the previous diagnostic tests, blood work, any specialty tests that you brought in by the patients. Reports are generated along with explanations. Multiple reports will be presented to you. Sometimes, depending upon the case, there could be 5 to 12 to 15 reports going back to you. I do not just run through the blood work with you. I go through each individual report. You watch an instructional video to explain that section of the report, and then we sit down and go over the specifics for your individual findings. So the patients, again, watch instructional videos, then they meet with myself or the staff to review food immune packets. Patient also watches instructional videos and the staff to determine issues with gut, blood sugar, basic nutrients that are required. Patient watches instructional videos and then meets with myself or the staff to discuss the expanded blood work panel. You'll also be given the required nutrients reviewed and given to you. Once again, we don't do any protocol stuff here. I have people coming into here saying, oh, I just went to this naturopath, and because of my ulcerative colitis, here's the protocol he gave me. I mean, that's really ridiculous. It's got to be custom specific to you. We don't do protocols. Patient watches instructional videos that then meets with me to do a 30-day reintroduction of foods once we've identified what you should not be eating. We do weekly reintroduction of foods or discussed back and forth. Many questions happen about that. What's good, what's not good. We also do ongoing talks, consults between the doctor and patient throughout the program. We have unlimited text, calls, emails with myself and the staff to answer all questions during in-office patient hours. There's re-examinations, consults, continued file review, ongoing review of nutrients and modifications. What you want to know too is practice means exactly that you're practicing with the patient. There is no protocol. There is no correct way to start off with someone. It's trial and error. And as I uncover what's going on through your testing and through your blood work and your specialty blood work, and then we start to move you in the right direction. And then we try this and we try this. And again, there's no protocol. And there is no exact path. Health is not directly up. Health sometimes can be like this, going up and going up and going up, and then gradually we can get to a higher level of function. We also will go over food modifications, We review specialty panel blood work and instructional videos. If we've done any ASI testing on you, saliva testing, genetic tests, we go over that with you. And then we do a re-examination that's conducted at the end of normally the in-house Super 7 testing. We give you our basic final thoughts, and we give our basic continued ideas moving forward. Hey, here's the basics of what you can do minimally, and here's the best suggestion now that I have a complete review of you. Range of hours spent with a patient to do these, just this portion of it, is between 26 and 42.5 hours. It's a lot of time that we put into this. It's not something that we rush through. I will tell you this, the more that I study normal physiology and how things work and mechanisms of action, the more valuable I become to you as a doctor, because I can uncover. And then if something is not working, go back to how do things work? That's my specialty. How do things work? What are the stressors preventing this from work? And what else can we do moving forward? So my toolbox has, hundreds and thousands of tools in there, where most doctors that you go to, the tool may be a simple drug, or again, they're going to give you the protocol for whatever issue is that we're talking about. Again, ulcerative colitis, Hashimoto's, they give you their 5 key ingredients, and that's what they use over and over again. And if you get stuck, they don't know where to go. So the key is to understand mechanisms of action, and then what we can do to positively influence those and raise the person's healability. So thank you. God bless you. God bless your family. And God bless the United States. Thanks.